We need absolutely new cures, new treatments in order to better manage this disease. My name is Federica Ungaro. I'm a group leader in San Raffaele Hospital. So we study the pathologies associated with the gastrointestinal tract, and in particular inflammatory bowel disease. We call it IBD. It's a chronic inflammatory disorder of the gastrointestinal tract, and this chronicity impairs quite often the IBD patient quality of life because they can have discomfort, abdominal pain, bleeding, diarrhea. So you can imagine that IBD patient can't live a good life if they are not treated properly. But the problem is that despite the existence of a plethora of drug treatments, many patients cannot respond to this treatment or in some cases develop resistance. And so patients can develop again the symptoms and discomfort and all the problems associated with IBD. Our goal as researchers and as clinicians is to find new cures with efficacy, but at the same time, low side effects. And the algae-derived compounds are, in my opinion, promising in this sense. These algae compounds are natural products, so they are quite tolerated from the human organism, and so they are supposed not to have side effects. One of the third things that should be done before telling somebody that a drug is working is to test them in experiments. And we take advantage of mucosal biopsies. Patients with IBD undergo endoscopy. And during this endoscopy, we can pinch some biopsies of the intestine and collect them. The biopsies is transported directly in the laboratory. So we don't wait any time for the samples to be deteriorated. The advantage is that we are using samples that are supposed to display the exact situation of the patient in that moment. So if a patient is inflamed in his colon, it means that this biopsy is inflamed as well. So we can test exactly in that patient whether the algae-derived compounds can be beneficial and anti-inflammatory. We have a plate that we use normally for our test. This biopsy is put in this plate with some medium. The algae-derived compounds are added to this medium to let them have a function on them. And then we can measure after 24 hours, 48 hours of treatment whether they have been effective. After the testing, we will select a specific compound that has shown efficacy, and then we will test it in animal models. So there are several types of tests that, of course, have to be done in order to be sure that the algae-derived compounds are suitable, possibly in the future, for IBD treatment. I think that it is a very challenging project, but I think that there are the good people that can do that, people that work together just for one only aim and without competition, with a lot of collaboration to ameliorate the overall quality of life of IBD patients.